Hi, my name is Kathy Clark. I'm an exercise physiologist and I help to provide exercise programs at Ramsay Mental Health. Today I'm going to speak to you about the power of exercise and how we can use exercise as medicine. Important to keep in mind that exercise doesn't need to be anything complicated. I think we can become really overwhelmed by all the information on the internet nowadays and what we see on television. You don't need a chair that vibrates and you don't need exercise equipment at home. Even just getting out and kicking a soccer ball with your children or taking your dog for a walk, that is exercise, absolutely. Some of the biggest fears that stop people from accessing an exercise physiologist, I think, is having to come into a gym setting, remembering that you can exercise from the safety of your own home, and from a costing standpoint too, just knowing that to exercise at home is just as effective as using a gym. The only benefit sometimes of having a gym is just having people to be accountable to, and sometimes having that social support that you need just to make sure that you're getting through the door a couple times a week. So when a client is referred for exercise physiology, they will have been referred by their doctor, their GP. So their GP has deemed that they are safe to participate in an exercise program. We will still do screening in relation to any risk factors that might be present, so that when we're developing their individual program, that those will be really taken into consideration as well. In relation to group exercise sessions, they are very small group sessions so that we can really still cater to the individual person's needs. Quite often in those group settings, every patient will be given options so that if they're dealing with an injury in addition to mental health concerns, we make sure that the exercise physiologists are very well trained so that they can adapt the exercise for the individuals that are in the room. In addition, if there's a high risk of injury or a complicated history, then there is the opportunity for people to access the exercise physiology services in a one-on-one setting. So a typical group exercise physiology session would be just a warm-up component, and that might just be marching on the spot just to elevate heart rate. And then normally we'll do a combination of balance exercises with strength training exercises, with endurance and flexibility. So all of the components that are really essential to overall wellness. And then finishing with a cool down, and quite often in most of the group sessions there'll be a relaxation component, which is so essential for people nowadays. We're so driven by time constraints and technology that very few people take the time just to relax. So there'll be a relaxation component as well. I think one of the greatest myths out there is that people don't believe that they need an exercise physiologist unless they're an elite athlete. I think the people that really need the assistance of exercise physiologists are those that are dealing with physical or mental health issues, and especially those that aren't confident with how do they set up an exercise program and what would be safe and appropriate for them to do. So everyone and anyone would benefit from coming in to see an exercise physiologist just to get them started and on their way to feeling motivated and empowered. Who would benefit from having an exercise physiology session? As an exercise physiologist, I think everyone would, regardless of whether you're dealing with mental health issues or physical issues. But from a mental health standpoint, we know that it elevates moods, we know that it helps people think sharper, we know people sleep better, and we also know people make better decisions. So there's that spiral effect of when people start exercising, they start sleeping better, they start moving better, and they start making better decisions as well. The recommended amount of exercise per week is 150 minutes per week. So ideally, we'd love to see people moving 6 or 7 days a week and breaking up those 150 minutes. We prefer you not to be the weekend warrior where you do all your 150 minutes in a weekend. So just small amounts on a daily basis are so powerful in combination with eating well and hopefully sleeping well also. The best time of day to exercise would be first thing in the morning. If that isn't a possibility for you, whenever you can fit it into your day is the best time of day for you to exercise. I realize people have many obligations and schedules that are really jam-packed, but even doing something like parking your car at the end of the parking lot or taking the stairs instead of the elevator, that's exercise. So just fitting in little bits and pieces. Practicing your balance while you brush your teeth. Anything like that goes a long way to really helping people incorporate it into their daily lives. A normal exercise physiology session would be a 30-minute consultation when we're doing one-on-one looking at history and health concerns. The group sessions that we run in the mental health unit are 1-hour sessions. But keeping in mind that people that don't feel that they can participate for a full hour are welcome to come and just do the warm-up or the cool-down. They most certainly don't have to participate for the full hour. What is the best way to optimize your time with the exercise physiologist? I think coming prepared, but coming with an open mind and a positive attitude is also really essential. I know fear is a factor for a lot of people, so just trusting that you'll be well cared for. And once you arrive, just putting in your best effort so that when you leave, you really feel like you got the benefit from the program. Through your time in the mental health unit, you will be seen by the same exercise physiologist for every session, so that allows you to really build rapport and trust with that particular practitioner, and that way you'll feel safe sharing any concerns or fears that you have. One of the most common questions we get from patients who are keen to participate in the exercise program is, what do I need to bring with me? So just come in comfortable clothing that allows you to move freely, and closed-toe shoes, ideally running shoes or sand shoes, and maybe a water bottle and a towel.